Hey guys, welcome back to the channel. First, I want to apologize. I am getting over a cold right now, so if I sound a little bit stuffy, hopefully I won't die in like a coughing fit. I do have my tea with me, so hopefully I'm good to go. But I apologize about the sound of my voice right now. Again, just getting over a little cold. Today, I want to talk a little bit about scar massage and how you can do your own scar massage at home, or how you can teach your patients to do scar massage in the clinic. So yeah, we're gonna just talk about kind of how I teach people how to do scar massage. And then there'll be videos to come about some different tips and tricks that I have for dealing with tricky scars as well. Yeah, so without further ado, let's just hop right into it. So the first thing that you need to decide with giving scar massage instructions to a patient is you want to make sure that the scar is suitable to have force applied to it, right? So if it's a post-op patient or even somebody who's had stitches, something like that, like an incision, you want to wait about 48 hours after the stitches are removed to begin massaging right on top of the scar, because you want that scar to have that 48 hours for all of the collagen matrices to really come together, and for the tensile strength of the scar tissue to improve, so that you're not just continually opening the scar over and over again. If it's somebody that's had like just a cut or something like that, where they never had stitches or something, but let's say they had a cut and it was in a certain spot where they developed some scar tissue, just as soon as that scar is closed, make sure it's not open, and then you can begin with your scar massage. However, I do start scar massage around the skin that surrounds the incision. Right after their stitches are removed, they can start that. It just helps start to mobilize some of the skin, the fascia tissues around the scar, but they just don't go right up to the border. They're not pulling the scar tissue open, nothing like that. So that's when I usually have people start. So let's just pretend that we have a patient. I'm just going to use like a Sharpie. Let's pretend that we have like a patient who's just had a carpal tunnel. This is a little bit bigger than our surgeon usually does for his incisions, but just so that you guys can see it well. So that's kind of your scar. Let's say it's been about 48 hours since their stitches came out after their surgery. So what you can do is you're going to have them kind of work their way around the scar tissue. They're going to do really light circles, pushing the skin back and forth. They're going to go all around the bounds on the outside of the scar. So not even just having to touch it, but just touching all around the skin. They can kind of do up and downward movements, right? Side to side, circles all the way around the whole scar. And then they're going to go over the top of the scar as well and just touching. Same thing, circles, forward, backward, up and down. Because what we're trying to do in doing that scar massage is we're trying to get the collagen matrix, which lays down kind of like a web. We want the collagen fibers to line up parallel so that they're organized, and that's going to help to get them organized. So that's kind of the cellular level. But on the surface, if you do scar massage regularly, it's going to help your scar heal better. So it's going to have a better appearance. It's going to feel softer. So it's not going to be hard and thick and rough. And it's going to help with sensitivity, right? So incisions a lot of times are very sensitive. We want to get them used to touch right away so that the nerves don't develop hypersensitivity. And it's going to help just the tissue length, and because scars want to shrink and they want to stick down to everything underneath them, you want to make sure that people are starting their scar massage so that we don't have any adhesions or issues secondary because of the scar tissue. So that's usually how I educate people on doing it. They can also use like vitamin E oil or argan oil, or like cocoa butter is what we usually give out. The physician at our clinic prefers them to have cocoa butter, but we can talk about some of those kinds of things later. And then we usually give Topagel too, or a silicone gel to put on top of their scar tissue at nighttime. But during the daytime, I have people just uncovered as much as they can be, no bandages or anything, so that their scar gets exposed to as much sensation and different sensory tactile objects as possible. And then I want them to be doing their scar massage at least 3 times a day with at least 5 minutes in each session. So I just tell them to keep working it all through the day, like everything, you know, sit down, watch TV, set a timer, 5 minutes, done. So that's how I usually have people get it in. So that's pretty much it for the video today. It's like a super short one. I know I've been doing a lot of long videos lately, so hopefully this is a nice break and change of pace, but hopefully it's helpful. You can always, you know, kind of show some of the video to your patients, or you can make a video of your own of how to do scar massage at home. I think the most important thing is just educate your patients, tell them why it's important, what they're doing, and give them motivation to do their home exercise program, right? So some people are worried about the scar appearance, so you might appeal to them by saying, hey, if you do this, your scar will look a lot better when it heals. It will be flat and it will look nice. It will blend into the skin. Some people don't care about the cosmetics of it, but you can tell them, hey, you know, if the scar ends up sticking down, you're not going to have the normal movement that you should. You're not going to have, you may have more pain because it can stick down to nerves. So it's going to cause trouble if you don't do it. So just try to motivate them. It's really an easy thing to do, but definitely include it in all of your post-op programs, and review it with them too. Every session that you see them, hey, how's it going with your scar? Are you working the scar tissue? Yeah, it's very important. People don't think about scar, but it ends up being very important. And a lot of times people will come in, you know, years after surgery and they still have pain. And it's really because of the scar, the skin, fascia tissue, adhesions. So it's a really big, important part of what we do. So definitely don't underestimate the power of scar. I hope you guys enjoyed this super short video, and hopefully you're having a great day. If you liked the video, please subscribe to the channel, hit the like button below, and thank you guys so much for watching.